All right, so as Danielle said, well, I'm just going to try and give some context of how to sort of think about the talks over the next 2 days and try and talk a little bit about the journey that we all go through as parents, from having a sick child to where we want to be, which is on effective, safe treatments, and how the talks sort of fit with that. Now, Danielle's challenged me to tell me something doing for the first time. So this may seem strange to you, but part of Will's passion is Highland cattle. I don't know where that's come from, but Highland cattle. And so this year, for the first time, I'm going to be leading a Highland heifer in the ring at the National Australian Highland Cattle Society show. And to do that, I need to shampoo it, blow dry it, do its horns and hoofs and everything. So that's a first for me. All right. So where do we want to be? So as parents of kids with developmental epileptic encephalopathies or genetic epilepsies, what we want is for diagnoses to be made pretty soon after birth or after symptoms develop. So pretty quickly know what's the diagnosis, very specifically know what's the gene, and to be linked in with support and resources, and then that diagnosis to then link through to what's that mean for the future. To have very individualised information about, for our child, what does that mean? Because as you'll hear about over the next few days, you might get a gene, in our case SCN2A, but then there's the gene variants, and there's many, many subtle variations in those variants even within SCN2A. So that individualised prognosis is really important. And then we want to start on a precision-based treatment quite quickly that's safe, that's tolerable, and more importantly, prevents the development of the long-term other consequences of having these disorders early in life. You know, thankfully for us, Will's through the sort of the storm of early life that's characterised by gain of function in SCN2A, and his health is now much more stable, but he's left with a lot of other defects that we don't know how much of that's permanent, how much may be reversible in the future if he gets a gene-based therapy. But what we really want is, before any of those things develop, for someone to be on an effective gene-based therapy, and we also want seamless, coordinated, ongoing care. So where have we come from? So I thought this was a nice time to reflect. This is now our 6th meeting of GETA. So 5 years ago, we had our first meeting in 2017 in Melbourne. And I remember then, you know, Steve was talking about some lab-based work looking at the function in sodium channels and how he may be able to modulate some of that function in sodium channels. And you'll hear a lot more about where that work has come to and what's come from that today. But where we were was that for some genes you could get a genetic diagnosis reasonably quickly, but for a lot of genes you didn't get a diagnosis at all because those disorders hadn't been characterised, or it took a long time to get a diagnosis. Very little support, very little coordinated support groups, not a good understanding of individual prognostic information, and treatments still largely very symptom-based treatments. You've got seizures, here's a seizure medication that might reduce the frequency of seizures, but it's not going to change the long-term prognosis for our children. And also too, the treatments weren't informed by the underlying pathology. It's okay, you've got a seizure, I'll put you on a seizure drug. Not you've got this particular channel defect that's going to modulate your cells in a particular way, therefore we're going to choose this particular anti-epileptic. We weren't there in 2017. And we didn't have precision-based treatments and no ongoing support. So where are we now? And then this is what you're going to hear over the next 2 days. And some of it's going to be a little bit about where we've come from, where things are going into the future. And I've really tried to put the pictures of the speakers you'll hear over the next few days alongside some of these points, so that then as you hear the talks, you're going, okay, that's where in my framework this fits. Because we've got lots of barriers still in terms of to get to where we want to be. But the more we can understand, okay, all the different moving parts, and okay, that's where that's going, but I need this, and you know, we're still doing this work, that's going to help us continue to move forward. So in terms of the genetic diagnosis, that's really changed. It's much more accessible now in Australia, particularly for young kids presenting with very typical symptoms of a developmental epileptic encephalopathy. Can be possible even within weeks. And you'll hear a talk tomorrow from Matt looking at not even gene-based testing, but some sort of using sort of smart technologies, bioinformatics, to try to look at how you might be able to get a very early diagnosis or sort of early characterisation of particular syndromes. Patient support groups are now more organised and accessible. Epilepsy Foundation's really trying to develop what they're doing in the genetic epilepsy space. CoGenes here in Sydney are doing a lot of work in this area that you'll hear about across the next 2 days. And we're getting more information about the prognosis. So a lot of that work's come from Steve's lab, and Steve will sort of allude to some of that, of characterising the particular gene variations and what does that mean in terms of function. But you'll also hear from Amy Schneider tomorrow about some of the other comorbidities that go with the DEEs and some of the other symptoms and how all that might interact. Steve's going to talk about precision treatments up next in a range of different genes, and some are close to clinical trials, some are much more at a sort of basic science type of level. All our different genes are at different points along this pathway. But hopefully you'll see, if we try and map out over the next 2 days what that pathway is, you'll find the point on that pathway that's relevant for you and understand these are the bits I'm going to confront or going to have to deal with moving forward. And we're going to learn as well from others in the room who are further along in that pathway. The CoGenes team in Sydney are looking at piloting coordinated ongoing support, and you'll hear from Emma Palmer about that later this afternoon. A lot of the work is being informed by natural history studies, and Jenny Downs is doing some important work at looking at what we actually measure in these types of studies. It's not just seizures, it's, well, what else is important? Some quality of life measures, because they're not just across natural history studies, but they come into when we then look at clinical trials, because we want the outcomes of clinical trials to not just be, my child has less seizures. We want those to be, my child is more functional, has better quality of life, is easy to care for, is more independent. And so that's where Jenny will help us understand how that can be integrated into clinical trials. Kate Beattie will talk to us about the journey, and in Batten's disease, we're a bit further along in the journey in terms of having a precision-based treatment. So Kate's going to talk about that journey. Some of us think, great, we've got a candidate molecule, clinical trials are going to happen within 12 months and it'll be in the clinic in 12 months. Unfortunately, that's just not the way these things go. So Kate's experience with her family will help us understand some of that journey from identifying, okay, here's a potential candidate molecule that could be used sort of first in humans. What does that then mean, and how does that look like as you then get it into something that's available, funded, readily accessible in Australia? Deepak Gill's going to talk to us about clinical trials, why they're important, what they can really bring to us as a community, both for our own children but for future children with our disorders. And then there's going to be some work on coordination of care. So again, Emma Palmer and Chris Pearce are going to talk about the work CoGenes and the Epilepsy Foundation are doing in this space. So thank you very much.